Okay, I'm just going to review the recommended safety procedures for radiation use. We measure radiation on our dosimetry badges here. We get these read once a quarter, and then we get reports back with our radiation doses on them. The maximum radiation dosage for a person in the veterinary field is that person's age minus 18, and then that number multiplied by 5, and it's read in rems. So I'm 25 years old. My maximum dose would be 25 minus 18, which is 7. That number times 5 is 35, so 35 rems. We get our reports in millirems, so 1,000th of a rem. So I'll go ahead and read for one of our doctors. So Dr. Laura Claire, and her current at that point was 44 millirem. And it takes a couple of different readings, deep and a shallow, and then an eye, but then her year to date at that point was 131, and then her lifetime at that point was 173. So those are the reports that we get quarterly. I'm going to just go ahead and take a look at some protective equipment, personal protective equipment. It's always a good idea to inspect it, make sure it's clean, make sure that there are no holes in it. This is a thyroid shield. It goes around the neck and fastens in the back. Oops. And this is the lead vest. Again, make sure that it's clean, doesn't have any holes in it. And put it on. Fastens in the back up there, and then it has a belt. And then the dosimetry badge goes on the outside of the equipment at about thyroid level. If the badge were underneath the protective equipment, then it wouldn't give an accurate reading of the radiation that I'm being exposed to. And then some other equipment that we have, we've got some lead gloves. The lead gloves need to encompass the entire hand and not just the outside of the hand, but it needs to encompass the underside of the hand as well. Other barriers that can be used to minimize exposure to the radiation beam is taking as few x-rays as possible, getting it on the first try, and then maximizing the distance between yourself and the patient by using a trough or ropes or wedges or sandbags. Those are just some equipment that you can use. No portion of any person should ever be in the primary x-ray beam because it is an extremely high dosage of radiation, and it could really affect the tissues. Radiation can have no effect on tissues, or it can have repairable or irreparable effects on tissues, and it can also kill cells. So it's just very important to keep all hands, whether protected or unprotected, out of the primary x-ray beam. All non-essential personnel should leave the room so that as few people are being exposed to radiation as possible, and every effort should be made to take that diagnostic image on the first try. The more x-rays that you're taking to get that shot, if you're not being careful, then it just increases the amount of scatter radiation that everyone is being exposed to. So it's really important to take the extra time to place the patient appropriately and make sure that you've got that diagnostic image. Restrictions are placed on pregnant women and people under the age of 18 because radiation does have a detrimental effect to growing cells. So with the fetus or with people under the age of 18, they have a lot of cells that are still in transition and growing. So radiation is really especially detrimental to them. So those are just some radiation safety measures in the veterinary practice. Alright, I'm going to be demonstrating proper restraint for taking radiographs in dogs and cats. I've got a cat here named Duncan, and I'm going to show just a few different positioning aids that we've got here and get him in a couple different positions. So first of all, we can do a lateral position. I've got my assistant here. She'll take the back legs. We're going to put him in right lateral and take his feet towards us. Lay him down. And now he is restrained in right lateral position, and then we can collimate our x-ray head to the appropriate collimation for whatever shot that we want to do. So one of the positioning aids that we have is some gauze, or you can also use some rope. If we were trying to do an x-ray of one of his legs, we could put the gauze around his leg. Yeah, bud. Put the gauze around his leg, and we could pull that leg out, and then this allows me as the restrainer to get this arm far away from that x-ray beam. So that's one of our positioning aids. Another view that we can do is a ventrodorsal view, and it's nice to have a trough to help with that. It keeps them straight. So we'll get him into the trough, 1, 2, 3, turn him upside down. So now he is restrained in the trough, so that's another positioning aid that we have. And if we were taking an x-ray of his thorax, I would extend his arms cranially, and then if we were taking of his abdomen, we would be extending those back legs out. Another positioning aid that we can use is a sandbag. This also helps reduce the number of people in the room, because on calmer animals, like if we were taking a thoracic x-ray of him, we could put the sandbag over his abdomen, and then that kind of helps him to stay in place, and then we wouldn't need the assistant at the back. So those are a few ways of positioning patients for x-rays and some positioning aids to assist with that. All right, we're going to be doing thoracic x-rays on a cat. We have our machine set to 70 kPV and 5 MAS, which are the recommended settings for our machine. I've got my assistant Ben helping me. We are going to place this cat in ventrodorsal positioning in this trough. I'll go ahead and take the front, Ben will take the back. We're going to put him over onto his back. He's a little bit wiggly, so we're just going to let him settle. And then pushing the whole trough more cranially, and then I'm going to collimate so that in our shot we have his first lumbar vertebrae, which is right caudal to his rib cage, and then all the way cranially to the thoracic inlet. So thoracic inlet to the very last rib there. And I'm going to extend the arms cranially, and then we have our right marker, which is going to go on the cat's right side within the collimated area. All right. And I've got the elbows extended, so I'm going to say 1, 2, 3, take the x-ray. And that is how to do a thoracic x-ray on a cat. Alright, I'm going to be utilizing radiographic equipment to take x-rays on a non-portable machine. Our non-portable machine has preset settings based on the standard operating procedures, so these are the guidelines that we follow for our animals here. I will be radiographing a less than 20-pound feline on an extremity, so we'll be using KVP of 52 and MAS of 10. So on our equipment here, I have set the KVP to 52 and the MAS to 10. All right, and our machine does not require calipers to be used in order to help figure out the KVP and MAS, but I will kind of demonstrate how that would look like. So we're going to be taking a craniocaudal radius ulna on this cat. So I will be collimating to just proximal, from proximal to the elbow to distal to the carpus to make sure we've got both those joints and the radius and ulna in between. I'm going to have my assistant help me, so she is going to kind of give him a hug with her body so that he cannot back away. And then she's going to be pulling his neck laterally out of the shot. I have some gauze that I have tied around his carpus so that I can pull his leg out. And then with calipers, these are not radiographic calipers, but with these calipers, I will measure the thickest area of this shot, which is right distal to his elbow, and that is 23 millimeters, so 2.3 centimeters. So if I were using a machine that required that, I would use that measurement to set my KVP and MAS. I have my right marker, which I will put up toward his elbow, and then we will expose the shot. And then we'll just take a peek at the image that was exposed to ensure that we got the correct positioning. And indeed, we got from the elbow to the carpus and the entire radius and ulna in between. Alright, I'm going to enter some new patient information into our x-ray system here. So I'm just going to go up to this upper corner and click add. Patient's first name, I'll just do my own dog. My dog's name is Rosemary. And it asks me to put in my ID number. The dog's weight, she's about 30 pounds right now. She is a canine. Then put in the owner's last name. And then the last name of the patient, just in case it's different from the owner. And then I'll put in her age. She's about 6 months old. And her breed. She's an English Shepherd mix. It's not on here, so I'm just going to put mixed. And then we'll click the next arrow. And then it gives us a list of selected regions. So if we wanted to do, say, 2-view thoracic x-rays, I would click on the body, I would go to thorax, and then I would click the recommended views that my doctor wants me to have, whether it's the ventrodorsal and lateral right. That's typically what we do for 2-view x-rays. I'm not actually doing x-rays on her, so we're just going to cancel out of that. If I were to look up a patient, so we did some x-rays on a patient earlier today, I would go ahead and I can search by the pet's name. So I put the pet's name in and I can search for that, and her name was Tilly Fish. So I would just double click on her, and these are the records that we took today. I would click on play so that I can view them, and now I can view the images that we took today. We did 2. We can also search for other parameters. We can search for the owner's name. We can search for which veterinarian took the x-rays. We can search for technicians who had been taking x-rays, study numbers, patient IDs. Those are the different parameters that we can search for, but typically we just search for patient names. We can also select the time frame in which the x-rays were taken to narrow our search parameters down. We can search patients in last day, last 2 weeks, last 2 days, last week, last 2 weeks, last month, or just all. Typically we just search the last day. And that is how to kind of use our x-ray system here. Alright, I'm going to demonstrate how to keep a radiographic log on paper. We took some x-rays on a basset hound named Annie, so I've got our x-ray log here, and I inputted today's date, the patient's name and ID number, the views that we took. So we took a ventrodorsal thoracic and a lateral right thoracic x-rays. The KVP was set to 80, the MAS was set to 5, and those are preset numbers based on the SOP of our machine. And then the technician initials. So that is the main information that is needed in a radiographic log. The way that we take our x-rays, it's on a digital system, and then we notate in the digital medical note that x-rays were taken. So for Miss Annie, under diagnostics performed in-house, we took lateral right thoracic x-ray, VD thoracic x-ray, and then under assessment, the doctor is going to assess the x-rays, determine if they need to be sent out to a radiologist, or what her assessment of the situation is. If the x-rays are sent to a radiologist, then they are scanned into the system and attached to the medical note as an attachment. We would click new file and then attach the radiologist's report directly to our digital medical notes. Alright, we're going to be performing an upper GI contrast study on a 5-month-old basset hound named Bailey. She's presenting with recurring vomiting, anorexia, chronic weight loss, so we'll be focusing on her stomach and her small intestines. The survey radiographs do not indicate a foreign body or any other underlying issue, and intestinal perforation is not suspected, so we will be using barium. And I'll show the administration, some of the administration of the barium. We're specifically going to monitor gastric emptying and focusing on the pylorus. We'll administer the barium and then take lateral right and ventrodorsal abdominal x-rays immediately after administration, and then 15, 30, and 60 minutes after administration, and then hourly until the barium reaches the distal small intestine. The doctor is also going to have us take some lateral right and ventrodorsal thoracic x-rays to monitor the distal esophagus, and these will be taken immediately after administration and then 15 minutes after. And then I'll show videos of the thoracic lateral right x-ray taken immediately after administration, and then I will show a video of the lateral right abdominal x-ray taken 15 minutes after administration of the barium. Okay, I'm going to orally administer barium to Miss Bailey here. She is about 28 pounds, so I've got about 100 grams of barium mixed with some water in a syringe. I'm just gonna feed it to her slowly. Very slowly. She's doing a good job, just a little bit more. There we go. And then we're going to take some x-rays right after administration. Alright, we just administered the barium, so we're going to lay her down on her right side and get an x-ray of her right lateral thorax. And I've got my marker here that denotes the right hand side. Pulling her elbows forward out of the shot. And taking the x-ray. We're going to be shooting the lateral right abdomen on Miss Bailey for a barium study. Alright, I'm going to lay her down, feet towards us. Make sure she's nice and straight. Make sure my marker is in the shot and not in the dog. And we were able to collimate that picture enough to get her hips all the way to the cranial aspect of her diaphragm in that shot. Alright, I'm going to briefly discuss the results of the barium contrast study on Miss Bailey. We'll go ahead and just look at a few of the x-rays that we took. Our thoracic lateral right, taken immediately after administration, does show that the barium did go into the stomach. We'll go ahead and look at the lateral right abdominal x-ray taken immediately after administration, and again, we can see that the barium did go right into the stomach there. Looking at our ventrodorsal abdomen immediately after administration, we can see the barium did make its way into the stomach. And again, with the thoracic ventrodorsal x-ray, we can see the esophagus going into the stomach and the barium did go in properly. Next, we'll go ahead and look at the abdominal x-ray taken at 15 minutes. So this abdominal x-ray was taken 15 minutes after the administration, and what we were really trying to monitor was pyloric function, and was the stomach able to empty into the duodenum. And as we can see, the barium has made its way into the small intestine. So that does appear to be working normally. And then we also took an abdominal x-ray 30 minutes after the administration. I'll show the lateral right shot. So this is 30 minutes after the administration of the barium, and we can see that there is the barium throughout the small intestines there. So the pylorus does seem to be emptying into the duodenum, which was the main reason why we were doing this study. Nothing abnormal was noted with the distal esophagus, and the stomach and small intestines do seem to be functioning normally. So the doctor concluded that there were no abnormalities seen, no foreign bodies, and that there were no abnormalities. All right, we're going to do sedated OFA x-rays on a patient. We have a chart that gives us our KVP and MAS readings. So for a 57-pound dog, I am setting the KVP to 80 and the MAS to 8. That's what we've got those set at. Set up our camera here. Alright, so I'm going to measure at the thickest part of the hips. Our machine does not require caliper measurements, but I will just demonstrate for the purposes of this tutorial. So the thickest part of the pelvis would be the greater trochanter, and I will just measure that area with my calipers. Is perfect. So 80 millimeters. Right, I'm going to position the hind legs for OFA x-rays. We're doing VD pelvis. So I'm going to make sure that it is centered on his pelvis. I am collimating from the most cranial aspect of the pelvis, and we need to include just distal to the patellas. A little forward. Okay, so I'm going to push his legs up, turn them medially, and while rotating his femurs medially, push back, pull back, and extend him as much as possible, and expose the image.